I think we were struck by a number of observations on the ground, as well as by data that we saw comparing Canada's healthcare systems to their international peers. On the ground, we had a sense of, as I said earlier, frustration of people unable to take great ideas to scale, to transform healthcare in their jurisdiction. And it, I think, led not only to frustration, but a sense of bottled up creative energy that really seemed to wear people down. They weren't giving up, but they were certainly a little worn down by the struggle to make things better. And a system that didn't seem to be structured to enable them to make a difference in a reasonable time frame, or even to encourage them to make a difference, and yet they persevered. And that was notable. From the standpoint of international comparisons, we were struck that our system had not evolved very far. Much of its architecture was similar to what was created in the 1970s when Canadians first embarked on a national set of medical insurance programs to complement hospital insurance. And that really, again, gave us a sense of a set of programs that had not adapted, had not evolved. And the international data certainly supported the view that other countries were making changes, other countries were evolving and adapting. And I think that's why the report cards of various types showed that Canada was slipping. The OECD data were uneven. In some areas we were holding our own, other areas we'd fallen. And that was not a dramatic decline, but it was notable. One of the particularly striking findings was from the Commonwealth Fund. The Commonwealth Fund is a very respected and impartial observer of international healthcare systems. They focus on peer nations. They had a report card in 2014 evocatively entitled "Mirror, Mirror on the Wall." And I think many Canadians in healthcare and more generally were shocked that we were 10th out of 11 peer nations overall in terms of our healthcare system's performance. And in most of the dimensions, we were middling or mediocre. Only the US overall fared worse. And more than a few of us wondered, with the changes under Obamacare, whether it would be maybe 3 or 4 years before we were firmly in last place. I don't think that's where Canadians want to be. It's never where our healthcare system has been. We've had a system that has been very reputable. And I think Canadians want and deserve better.